The Triangle of Care was established by the Carers Trust, and it came out of carers, family members, feeling that their needs weren't being met by mental health services, particularly when their loved ones were being admitted to inpatient services. They felt that all of the communication was going through the person that they were supporting, and they weren't being included in decisions, they weren't being included in conversations, and they didn't have the opportunity to share important information. From this, the Carers Trust developed Triangle of Care to be working across community mental health teams, but also across all community services. And how they did this was by identifying 6 standards. And these 6 standards meant that teams and organisations could hold themselves accountable to the needs of carers. And they could benchmark where they were in terms of meeting the needs of carers, family members, but also, and I suppose this is the important part of the triangle, the integration of working with the person themselves, their family members, their contexts, and the staff who are supporting them.
I think going onto the ward for the first time when you are a carer, but maybe at that point you don't even think of yourself as a carer. That's the point, you're accompanying maybe your child, or in my case, my husband. And it is a very frightening place. Everybody's got a job, everybody's rushing around. There could be a lot of noise that you don't understand. What are you bringing your loved one into? It can be a very, very scary place. And that's why it's so important to look to the staff for reassurance. It's good to be able to tell the staff how a carer actually feels and for the staff to appreciate that. And although I started my little phrase many years ago, please work with me to help him, the Triangle of Care reinforces that 100%.
Hearing firsthand from carers about their experiences, whether that be good or not so good, I think has really made staff think about the way that they engage with carers and families. There was a time where maybe there'd be occasions where carers didn't feel listened to and didn't feel involved, and I think that the Triangle of Care and that engagement with carers through their assessment is helping people to feel more involved.
So Rethink work with the Triangle of Care in partnership by working with carers leads at the community mental health teams and attending the steering groups and putting forward new initiatives of how carers can be supported.
I was a carer to my son Edward through his teens, where we couldn't actually get any help. As a family, we struggled with a very difficult and unpredictable behaviour. And it wasn't until he had a really bad psychotic episode that he was sectioned and taken into hospital. I was kind of relieved when he went into hospital because I thought he was going to get the help he needed, and he did. But he was just over 18, and as a family, we were frozen out because he was considered an adult and nothing could be told to us because it was confidential. I used to visit him every day in hospital, and I walked through the corridors like a ghost. Nobody saw me apart from my son, and this carried on until he was in recovery and he left hospital. And these people who wouldn't talk to me and wouldn't give me any information about my son suddenly said I was his carer, and he was handed over to me with no information and no idea how to support him or myself. And the next few years we were in and out of hospital and sectioning, and the very end of this story was the fact that I knew Edward was becoming very seriously psychotic again, and I was watching it happening, and none of his mental health team would listen to me, and Edward ended up taking his own life. I started getting involved with Rethink Mental Illness as a volunteer because I wanted to do something for people who were involved with mental health, the people they were supporting and those that were doing all the supporting of those people who were unwell. There's been a lot of changes, I think, within the Triangle of Care. When I first started the carer support line, we used to get carers who were very angry, very frustrated, because when their person was in hospital, They couldn't get anybody to speak to, and nobody would listen to them, and they were really upset and frustrated, and it took a long time, sometimes an hour on the phone before they calmed down and you could actually hold a conversation with them. Now when many of them come on the phone, I'm not saying that doesn't still happen, it does sometimes because of misunderstandings and things, but mostly now when I speak to a carer on the phone, they're upset and stressed with the role they're in as a carer and they need someone to talk to. But if you ask them how the ward is and how the staff are with them, you get a positive feedback, and that people do listen to them and they do know and they are given support.
My mother was first diagnosed with bipolar schizophrenia when I was 11 or 12, and so that means I've been a carer for her for about 30 years. During that time, there really wasn't any support at all. Nobody had mentioned the word carer. I wasn't spoken to directly by any of the staff in the hospitals. That led me to want to be able to tell my experience, my story to others. I delivered my talks to some Triangle of Care learning sets where different organisations within the mental health setting get together and learn about how to deliver the best care possible for carers. I've had 2 ward nurses feed back to me that because of hearing my story, they've then gone on to create a carers room within their ward. So the impact of hearing a first-hand account of what it is like to be a carer has made them reevaluate how they deal with carers on the ward.
I listened to quite an inspirational speaker called Shelley, who spoke about her experiences as a young carer and then as an older carer. And it got me thinking about some of the things that we do or don't do, as the case may be. And I looked at how we could bring all that together and actually provide that information. We're a busy ward, so sometimes it's not that we don't want to, sometimes we don't always manage to do the things, the one-to-ones with the carers as well as the patients. So we've just had a refurbishment last year and we've got some rooms that I was looking at making into different spaces, and I suddenly thought that the old quiet room that we used to use would be a really good carer space. It was situated as you come onto the ward, so it's ideal for a patient's relative when they come in and they ask how Fred, Mary or whatever's doing. They can go and sit in the carer's room, and then the key nurse can have a word with them before they actually go onto the ward until they actually meet their relatives again.
So the triangle of care is really, really important across, I feel, of the whole of Dorset. And it fits in really well with lots of other initiatives that we have coming through, particularly around the personalisation agenda. We have lots of initiatives that are coming from NHS England, from the County Council. There's lots of new things going on. But if we are doing the triangle of care, it will fit into all of that. All those initiatives will somewhere in the 6 standards that we work towards will fit in with that, which to me makes sense.